Unfortunately, the vicious cycle of poverty is a barrier to accessing healthcare. Even women who are insured sometimes don't seek the care that they need because of the cost. And so that's why the pay gap is significant. We have to still address that. Women are still making 82%, 82 cents to a dollar for men, and then it's 63 for BIPOC women. So that impacts health. And so thinking about that, teaching women how to not be afraid to negotiate for a higher salary. And as women in leadership, making sure that we are adjusting our salaries adequately to match what male counterparts are making. So those are the things that we can do. And then maybe finding ways to get businesses to put pressure on some of the insurance companies to see, can we get better rates to help our employees out here and not strap the employer with higher rates to help out their employees. So I feel like there's ways that we can all kind of work together to help this and show like the business impact of it sometimes. I think that helps in these conversations. There's 41 out of our 77 Oklahoma counties that are considered maternity healthcare deserts. And like I said, those numbers are getting worse. 18% of Oklahoma women were unable to see a doctor in 2019 due to cost. And that was regardless of whether or not they had insurance. And then 30% of Oklahomans reported having unpaid medical debt. And so we are eighth most indebted in the nation with regard to unpaid medical debt. So those are other barriers to people seeking the care that they need. If you have to choose between putting food on the table and seeking preventative care, you're going to choose that. So the pay gap does play into all of that. So yeah, all of it's interconnected. Access to safe and affordable housing. We had to add safe to it because affordable is one thing, but is it safe and livable housing? And that's become more difficult in Oklahoma to find safe and affordable housing. So access to parks, access to clean water, all of these things are interconnected. And so I feel like no matter what sector we work in, we could play a role in actually improving health outcomes and for not just Oklahomans, for women around the nation.